Welcome along. You are listening to Prevention is the New Cure, all things health and NHS with a political twist.
And that's with me, Dr. Helen Stokes Lampard, and Steve Brine, former MP and chair of the Health Select Committee. Morning, Steve.
Good morning, Helen. Nice to see you. Episode 34.
Doesn't time fly? Do you know, it just feels like 2 minutes ago we were waiting for the general election to loom.
And the first episode of the new dawn that has broken, has it not?
Indeed, with a bang.
Yeah, so last time we were talking about the general election and we were talking about what the parties were saying in their manifestos or whatever they wanted to call them. And we were saying all the different commitments that have been made in health on prevention and otherwise. And now it has happened. Labour have won. Who knew?
I know. Wasn't it remarkable how accurate the polls were all the way along? But also the exit poll. I mean, unfortunately, I had a really early start the next morning, so I couldn't stay up all night watching the results come in, which is what I wanted to do. But I stayed up for the exit poll. And Prof. John Curtis and his team, absolutely awesome what they do with the exit polls.
Well, yeah, but I mean, remember the polls were accurate in the sense that they said Labour would win, but throughout the whole campaign and for quite a long period before the campaign, they said that Labour had a 20-point lead. In the end, the final shakedown, Labour had a 10-point lead over the Conservatives. So, they would say, well, that's because in the last 24, 48 hours, things tightened as people believed the supermajority narrative. And therefore, we weren't wrong because we didn't poll in the last 24 hours. But the fact is that, did that impact on the behavior of the campaigns and the campaign that the outgoing government ran? I guess we'll never know.
No, but my reading of it was that some of that narrowing of the majority, although clearly the phenomenal landslide in terms of the seats, was about the big chunk of voters that moved across to Reform quite late on. So the Farage effect.
Yes, I mean that was definitely an effect. I mean, I said early on last week that I thought that the Conservatives would lose big, but not lose badly. And what I mean by that is that they would lose, that Labour would have a big majority, but that there would be lots of contests where it would be close. And there were Conservative seats that were lost by 15 votes.
I know.
Now, if you're the Conservatives, you're thinking, well, okay, that means that there is chance for a rebound.
Yeah.
The corollary to that is that there were seats that Conservatives won very narrowly. So Jeremy Hunt, the Chancellor, only won by 1,400, 1,500 votes. There were seats in Hampshire, in my area, which were 26, 27,000 Tory majorities just 5 years ago, who only won by similar margins to Jeremy Hunt. So they're now in play, very much so, for next time. And I suppose what you've got is a situation where the Tory party will now go into a period of introspection. It would be a mistake, Helen, for some of my former colleagues to think that if they made it this time, they've now got a seat for life. It is by no means certain that it doesn't get worse for the Tory party. It could. And what is the determining factor there? Well, how they respond to this, who they choose as leader, how that person performs as an opposition politician, which is very different to being in government, and how the direction, who they take the party in, and who they're talking to. I mean, you've seen what Suella Braverman's been saying in the last 24 hours. Very clear who she's talking to. A subset of the Conservative membership who will choose from the final two that the MPs give them. I'm not sure that's talking to the public at large. So, I think by Christmas, we will know, obviously, who the leader is, and we will know how they roll and who they're talking to. And that will tell us whether the extinction level event that did not happen to the Tory party last week is still yet to come. Does that make sense?
It makes perfect sense, Steve. And so for me, very much an outsider from all political parties, I've always maintained my political neutrality. It's very important to me, actually, to be able to do stuff like this and to do some of the things I do and get in the rooms that I get in. But I am quite fascinated by what the Reform effect and how that is going to shape the Conservative Party going forward, because there's incredible balancing act where clearly the winning party is to the left, but this much more extreme right-wing approach has obviously got a huge amount of populism in it. And what is it of the populism? What can be learned from this Reform effect, and what can be learned from what's happening around the rest of Europe? which can then be applied to the party to give it make it become the viable second choice. I mean, the other argument, of course, is what the Lib Dems have done. I mean, they absolutely had an awesome election, didn't they? I mean, what an improvement in terms of the seats, but without a massive change in proportion of the vote, but by concentrating their resources. It was clever what they did. I thought I was remarkably impressive electioneering.
I mean, look, let's put to one side that Reform, the Liberal Democrats particularly, complain about the voting system of first past the post, which they've now done very well under.
Yeah.
But you've got to play by the rules of the game as they are at the opening whistle. So they've done very well because they've won the votes in the right places, and that's why Labour have got a big majority, not because they've got a big national vote share. They've got the lowest national vote share of any majority government since the war, but because they've won in the right places and they haven't stacked up votes in Tooting where they were always going to win anyway. But I think, and we'll talk about the government imminently because they now matter and the Tory party doesn't. But the Tory party should remember that it didn't lose to Reform. It lost to Labour and the Liberal Democrats because it deserted the centre ground, or was perceived to have deserted the centre ground. Many voters saw the Tories as being tired, being out of touch, and I think crucially not competent. We had a narrative that was talking tough on immigration, so we talked tough, but that put some voters off in places like Winchester, where I used to represent. And then we didn't deliver on some of that talk, which then put off a whole other group of voters in the so-called Red Wall who wanted to see the talk and the delivery. And consequently, you have a very interesting House of Commons, very, very divided in many ways. Yes, you've got 400 Labour MPs, but you've got your pro-Gaza independents, you've got 71 Liberals, you've got a tiny number of SNP now, which is fascinating. And you've got some real left fielders in there, like Jeremy Corbyn, who won his seat. But anyway, look, let's talk about the government, because obviously
Can I
that's
just mention Jeremy Corbyn? Do you know how close he was to being Father of the House?
Oh, like one step in line, wasn't he? Being
1 minute
all
or
those
2
years
minutes
ago.
or something like that, all those years ago, 1983.
So just for listeners who don't know, what happens at the start of new parliament is that you swear your allegiance to the crown. And they were doing it yesterday, and they'll continue doing it today for the new parliament. But when we all got elected in 2010, and there was a lot of us, it was a bit of a jostle to be the first in the queue from 2010, because if you're second in the queue and you stay in the house for 40 years, then you wouldn't be father or mother of the house. I can't remember who was first in 2010. I suspect they probably left now. But it'll be interesting to see who from the 2024 intake got sworn in first, because they are in prime position to be leader of the house. Should they stay? Should they keep winning?
Well, I was having a chat with this is such a pretentious sounding phrase. I was chatting with a couple of Baroness friends of mine yesterday.
Oh yeah, is this in your Baroness group?
And this is another. Well, one of them is in my Dame group, but
oh, your Dame group. I love it. You have a Dame group. Do you have a WhatsApp group?
Yeah, of course. The most
is
awesome
it called? What's it called? Dame Watts.
We haven't called it that. We could do. No, we have a formal group for important announcements and meetings and things, and we have an informal chatty Dames group. But that's a whole nother world, Steve. No, chatting to two baronesses online yesterday, and they were chuckling to themselves about the newbies looking lost everywhere, and that they're making a really big effort to stop and say, where are you trying to get to? Don't worry, everyone's confused at the start. It'll pass, and just be thoroughly nice to everybody they bump into. But yes, they were being very maternal. It was really lovely.
Well, I was there for 14 years, and I still found new corridors and staircases after all that time. So you don't have much chance after 24 hours.
Must feel like
but anyway, look,
on a bad day.
We have a new Secretary of State. It is, of course, Wes Streeting, who took over the role. He only, congratulations. I've messaged him on the weekend. I mean, look, he only narrowly won his seat.
I know.
In Ilford, only by 500 or so votes. But congratulations to him. He becomes the new Secretary of State, and obviously has shadowed the job in opposition for a long time. So well done. Should we talk about his immediate challenges?
Well, he's got plenty of them, hasn't he? But yeah, both of us know Wes. And at least he's coming in as a Secretary of State who is very firmly understands the situation, has been well briefed, and is going to hit the ground running. I guess so if we do challenges and then what's been said so far, that might be a logical way to go through
What's the top of his in tray, would you say? Junior doctors strike?
Yeah, absolutely. And I think we should probably come back to that because there's some conversations happening.
Because so much flows from that in terms of waiting lists, etc., etc. Yeah. Okay.
But I think, their manifesto commitments were pretty clear cut, that the access, and the waiting lists are absolutely a big thing. So this pledge to get 40,000 extra appointments, I'm sure that's going to be a lot of pressure on the NHS to get that delivered. There was this really big thing that went out. So we're recording this on Wednesday. It was a big thing that went out on Tuesday this week, so that would have been on the 9th, about collaboration between DHSC and NHS England, and that essentially nothing is going to be done separately from each other. No more competition. It's all about collaboration. And if there are differences of opinion, that the Secretary of State and the ministers want to see those differences of opinion within one document and not parallel documents that say different things. I think that's a really interesting and bold and quite important step. Well, had you picked up on that, Steve?
Yes, my understanding is, of course, as well as the ministers changing, there's been quite a lot of change at the department during the election period. And,
Right.
you've seen them go out of their way, the new ministers. Amanda Pritchard has been there alongside Wes when he arrived at the department
Yes.
and on all of the visits that he's doing, which is not unusual. I mean, of course, she would have accompanied lots of secretaries of state. All I would say is that, I have heard this before. It is very difficult because NHS England is a big organization with lots of people who, are professionals, who have clinical background, who might not necessarily always want to run stuff by very junior new ministers. That can rub up. I've famously said before that when there was a difficult decision to be announced, it used to land on my desk than a couple of days before. When there was some good news, I would find out the night before that Simon Stevens was announcing it. And so, will that culture change? Be interesting to see. What's going to happen at NHS England, I don't know. Obviously, there is lots of talk, and people who listen to this are plugged into the NHS and will know that there is lots of talk being about, the Secretary or the Prime Minister was asked directly on the weekend, is Amanda Pritchard safe in her job? He didn't say yes, but I think Wes has subsequently said she is. I think there will be some other personnel changes, shall we say, at NHS England over the coming weeks. So that's something people may wish to watch out for.
Yeah, I've got to be careful because I'm on the board of NHS England nowadays.
Yes.
So I do have to be cautious in that. And I think it's fair to say there's a huge amount of tittle tattle going on, and not a lot of substance yet. I mean, there's two time opportunities for big changes, aren't there? There's the next couple of weeks, and then we know that the Labour government have said they're going to institute some sort of big review of the NHS England and where it's at. And so a logical second opportunity, I guess, would be post that review, if it is some sort of rapid review to help inform the next NHS long-term plan. So I guess I see those as the moments in time where stuff might happen. Does that sound about right?
Yeah, no, I think that's right. I mean, getting you mentioned the 40,000 more appointments every week.
Mm.
They've got to move fast on that. And resolving the industrial action is critical to that. But the new dentistry rescue plan.
Yes.
I noticed a photo went out on social media on Monday, which is that the British Dental Association were in with Wes. I saw Sean Charwood and Eddie in the photo, so they'd already been in to see him straight away, which is good. But
Yeah.
we can all have a meeting and take a photo. It's what is the substance of that? Where are we on replacing the dental contract? Because you're not going to get a dental recovery plan, a rescue plan, as they call it, unless you do that. The other thing I noticed that Wes has talked about in recent days is, which you'll be interested in, I know you won't have missed it, is saying that we don't invest enough in primary care.
Indeed.
There's too much budget that goes into secondary care. Now,
Yeah.
because we all know that you get a better bang for your buck in primary care,
Yeah.
but I've never visited a hospital yet, Helen, where they've said to me, "Do you know what we need, Minister? Is less money." How does he square that circle?
I think this is a massive challenge, isn't it? So yes, I'd be delighted to hear both the narrative about primary care needing greater investment. I mean, that's certainly true. All the details say to it. And when we talk about industrial action, I think we won't just talk about junior doctors. We'll talk about hospital doctors, and we will talk about primary care because of the lag is interesting. And I have to, declare the old self-interest. I am a GP partner in a GMS practice, but the money's got to come from somewhere. Um, the NHS is squeezed to the bone already because it's had to be with the whole austerity. There is no money. If you take things away from secondary care, that is almost inevitably going to mean, in the short term, stopping providing certain services or opportunities. I mean, that's the logical thing. You're
Or
going to
you
cut staff.
produce more, or you produce new money, which I'm not sure is there.
That's right. And I mean, so if they've said there are various sources of new money. I know the IFS have been quite anxious about the promises of additional money being raised and it not being adequate for what's been proposed. So I think this is one we could just got to watch really closely. I know we're not the only people watching closely. I know all the big health think tanks are on the case of this one. I mean, I've been very pleased to hear a narrative more about prevention, and that seems to be coming through in various ways. And certainly it was writ reasonably large in the manifesto side of things, although fairly superficial. What I'm hearing, Steve, I'd be interested if you're hearing the same, is that there are a lot of advisors wandering and floating around DH at the moment who come from the previous Labour administration, so who were around, 14 plus years ago. And I've heard talk, the big Aradalzi report called High Quality Care for All. A lot of the people were involved in that, and the ideas from that are being dusted off. Now, to be honest with you, that was a document ahead of its time, and I remember it coming out, and some people really struggling with it. A lot of good stuff did come out of that's happened, but a lot of the prevention stuff was never enacted. So I think there is scope to dust some of those things off. Any thoughts on that one?
I think that's really interesting. And I know you shared that document on our WhatsApp group yesterday. I
Mm,
think that's really interesting. And I would like, we said last time when we were talking about manifestos is that on prevention, a lot of the thinking has been done. We are
absolutely.
not short of an evidence base on this
Mm,
stuff. There have been so many reports produced, so many think tanks have produced events that have talked about prevention being better than cure. And, if that work from part of the Darzi stable in the 60th year of the NHS
mm.
is still valid, then let's bring it out there. We'll pop that report, High Quality Care for All, on our social media so that people can reference that and we'll see whether we're right. You
Yeah,
you are you are
heard it
right
here
that the goats are being appointed. And what I mean by that is government of all the talents. So the prime minister has appointed. Yes, it was a Gordon Brown expression. The prime minister has appointed James Timpson as the prisons minister.
first.
Really interesting appointment.
Really.
He's appointed somebody from the old Matrix Chambers, an old friend, as Attorney General. I make no comment on appointing old friends. And he's appointed Patrick Vallance as one of the
Yeah,
Science and Tech
Patrick.
and Innovation Minister, and they will be given peerages just so people understand how this works. In the same way as David Cameron was given a peerage so he could be Foreign Secretary. They cannot answer questions in the House of Commons, obviously, but they will be questioned in the House of Lords. Now, Patrick Vallance is clearly not a health minister. We'll come on to the new health ministers, such as we know in a minute.
Oh,
But Patrick is a good appointment, right? And he
oh,
came out for Labour during the campaign, so he's got his reward. But he will be working closely with the health department. And you know Patrick, don't you?
I do. I certainly do. So, I was absolutely delighted to hear Sir Patrick Vallance has been appointed. So, as we all know, he was the government chief scientific officer during the pandemic. So, he and Chris Whitty were a formidable double act in terms of the evidence and science and helping to keep us all safe. So, Patrick actually taught me in medical school, Steve. There's a claim to fame. So while I was a medical
Oh,
student in St George's in the early 90s, he was a senior lecturer, which doesn't take too much math to work out. He's just a few years older than me. Um, he was so clever as medical students. It was incredibly intimidating. I remember a professor saying to us that this man has a brain the size of a planet. And I think that's a huge compliment. And we were impressed with him and in awe of him then, and I'm still impressed and in awe of him now. He's also a thoroughly lovely, decent person when you get to know him. And actually, one little nice little thing, when I had my investiture to become a dame a couple of years ago, Patrick was getting his upgrade on his knighthood at the same time, which was
I
lovely.
love that, an upgrade. I
I
mean,
know.
they're good appointments, and credit to the Prime Minister for doing it. The challenge will be is that you bring people in from outside politics who are not steeped in, they've not learnt the trade, not been in the opposition whip's office or been in the House for a long time, and they come in with and I don't mean this patronisingly at all, but they come in with a slightly purist view that,
Yeah.
well, it's obvious what we need to do is X, and I don't, and then they get frustrated that it can't be done. And you've seen lots of advisors over the years who've come in to work with government who the homeless czar would be a good example from the last government, who sort of ended up throwing their hands in the air and resigning from the post because they realized that actually the levers of government and statecraft is very difficult, because when you come from the private sector where you can direct change easier, it is not the same in government and when you're running a state and when you're running a service like the NHS, which is obviously lots and lots of different organizations under one banner called the NHS. That is very challenging and can be very frustrating. So the trick for people like Patrick and Timpson will be, can they overcome that frustration and get the state to work with them doing what they want?
Absolutely fair point, Steve. I mean, what I would say with Patrick is, because he has been a civil servant for quite a long time, he has seen a lot of it up close and personal, and he's incredibly bright and will pick it up. Another appointment in that same package or bundle is Dame Jackie Smith. So because if you remember, I think she was the first female Home Secretary.
She was.
Yeah, Jackie. And so I know her because she's been the chair of University Hospital Birmingham. Of course, I'm in the University of Birmingham and she's up the road. And she's more recently chair of Barts in London. But she's actually been taken over. She's being appointed into education. So one of the junior ministers in education. So that'll be an interesting one to watch as well. And I think she absolutely falls into that category of having been influencing government in different ways, but not having been in through this route. So interesting times.
Yeah. Let's take a quick break and then we'll look at the new health ministers that have been appointed alongside Wes and some of the messaging that has been put out. Welcome back. So we were talking about the new Labour government. Wes obviously streeting as health secretary, but we've got some of the junior minister appointments. It's quite slow, I would say, on filling the ministerial team. But we know the ministers of state at the department is Karen Smith and Stephen Kinnock. Now, Karen is somebody, she's an MP in Bristol, where obviously Labour had a big Green Party problem in Bristol, and Thangam Debonair, who's her parliamentary neighbour, lost her seat and it was in the shadow cabinet. So Karen's done well to win her seat. I know Karen well, nice person. Used to work in the NHS primary care manager, I think in a primary care trust back in those days. I don't know exactly what job she's got, but as she's Minister of State level, I would imagine that she might well have the hospital minister's job. And then Stephen Kinnock, obviously Neil Kinnock, Glenys Kinnock's son, who represents a seat down in your neck of the woods in Wales.
Absolutely.
He has gone in as MOS, I think as Care Minister. And that is a very interesting appointment. Why? Because the Labour manifesto talks about a national care service underpinned by national standards, delivering consistency of care across the country. We don't know what that means, but Stephen is a serious politician who will have the ear of Downing Street. And I can tell you that when you are a minister in the department, it's not good enough to have the ear of your Secretary of State. It's not good enough to have the ear of your permanent secretary. You have to have the ear of Downing Street. And I think that Stephen does. So that could mean that big changes are afoot in care.
And I'd be great if that is the case, actually, Steve, because I think that is one of the areas where not enough has been talked about during the whole election campaign. And I haven't heard anything said about care so far. So let's watch that one and see what the whole of the ministerial team is. So as I said, we're recording this on Wednesday morning. Still waiting to hear, and then we're expecting there to be more ministers. There'll be a PUS. Is that a permanent undersecretary?
Parliamentary Undersecretary of State. So that's what I was. And there will be one who has the I suppose the women's health agenda, that's usually a PUS role, and the primary care public health prevention job.
Which we're eagerly waiting, aren't we?
Which I had. Obviously, that will be interesting appointment. And there are some really good people on the Labour backbenches who will all think they've got a chance of doing that one. So I won't name them and curse them, but we'll look out for that.
Lots of names have been bounced around, but let's not curse anyone just yet. And also, they usually have somebody from the Lords, don't they, over in health? We usually get...
They'll have a Lords minister, yeah. Obviously, James O'Shaughnessy was one of the Lords ministers. So in terms of messaging that has been put out, so the Secretary of State said on the weekend, previous governments not been willing to accept or admit simple facts. But in order to cure an illness, you must first diagnose it. The government will be honest about the challenges facing our country and serious about tackling them. From today, the policy of this department is that the NHS is broken. Now, this, in my opinion, is not a policy. It is a press release. It is a statement. and it is not necessarily, in all places, a statement of fact. What did you think, Doctor, when you heard that? How did it impact your morale as a frontline health professional when you heard somebody, the new Secretary of State, no less, saying the NHS is broken?
Okay. I am going to curb my initial reaction, Steve, because I'm a polite person and I am a dignified professional. But I did bridle at that. I mean, yes, apart from the grammatical nonsense of a policy being that something's broken, or a position something's broken, a policy is that you fix it, surely. But that aside, well over 1 million people are seen and treated very effectively every day in general practice alone. Hundreds of thousands of people are seen and treated every day in our hospitals, in our A&E departments, in our outpatient departments, in our communities. So certainly frontline professionals find that sort of narrative pretty offensive. Of course, there are whopping great cracks in the NHS. Of course, there are. Everybody campaigned about how to improve it and do it better. And of course, we said what are the priorities going to be? And absolutely, the workforce, the investment, the infrastructure, the technology, all those things need addressing. But I think hearing the Prime Minister here repeating a soundbite that we'd had from the new Secretary of State. I mean, we always get exasperating soundbites from new Secretary of State. Okay, they attention grabbing. They want to show the electorate they're listening. But I think in terms of morale, definitely an own goal. I also worry that it's reinforcing a headline grabbing negative stereotype that some of our less scrupulous media have been peddling, which then puts people off seeking care. I mean, honestly, on Monday in surgery, I had 2 patients who came in and were utterly shocked that they'd got an appointment when they'd phoned the surgery in the morning and said, "Oh, I've been putting this off for weeks and weeks because I couldn't face the challenge of getting an appointment." And the first time they tried, they got an appointment. Yes, they hung on the phone or they waited for 15 minutes for us to call back, but they got an appointment on the day with a doctor of their choice. This is not fairy tale stuff. So I worry that those people are still being put off. There's also other concerns, obviously, about the impact across the system. But anyway, let's just you get my message. I wasn't wildly impressed.
I get your message. I could see the politics of it, of course. And David Cameron talked about broken Britain back in 2008, 9, 10. I get the politics of it. But if you do it in the healthcare setting, you make that point really well, is that, if you've put something off for a couple of weeks, this can be very dangerous. And so, just please, the plea, let's remember that there is good and bad and indifferent in the National Health Service. And when you're the government, not the opposition. I fear this is still the opposition speaking. When you're the government, you have to be the NHS's biggest fan, but it's critical friend as well. And there are many times as a health minister where I wanted to say, but I would keep that to private, and but in public I would try and build up the people that were working with me, and I think that's the challenge.
And I think that's really receptive, that comment that this is opposition speaking, and there's a need to switch to becoming the leading.
I've done it a couple of times today. I've talked about ministers, and when I'm meant shadow ministers now, and you've heard shadow ministers formally on the radio in recent days talking about themselves as a shadow minister when they're now the minister. Old habits die hard. But I do feel there was an echo from opposition in that NHS is broken thing. They're now the government.
Let's just move on from that narrative and move to fixing it. I mean, blaming the previous, the previous leaders of the party was absolutely a normal thing for, swing parties to do. But let's just make this a brief episode and move forward, please.
So then on moving forward, that takes us very neatly, doesn't it, to the language of opposition, which is the junior doctor strike. We need to get in the room and sort this out. Okay, you're now the person with the room. You're now inviting the BMA in, and there are talks today, Wednesday, as we speak, about resolving junior doctor strike. Now, I've said this before, so I'll say it again. The last government offered 9%. And then another 3%, a 12% deal. The Junior Doctors Committee, the BMA, want 35%. The last government said that was unaffordable, where Streeting and this government say that's unaffordable. So he's saying what we need to do is get in the room. If only we'd thought of that. They're in the room right now.
Yeah, which is
where between 12 and 35? That's the question, right? And if it is 15 or 16, then okay, fine. How do you pay for that? Where does the money come from? I predict what will happen is what's happened in Scotland and Wales with SNP and Labour governments, respectively, is that the BMA Junior Doctors Committee and the government will issue there'll be some white smoke. They'll talk about pay restoration over a period of time. and the strikes will be ended. I don't think they had any intention of ending it with a Tory government, but I think they will end it with this Labour government. Do you think that's fair?
I think you may have a crystal ball there, Steve. I mean, so first thing, credit where it's due. First call that Secretary of State made when appointed was indeed to the BMA, is my understanding, which is fantastic. And great that the first meeting he had was actually with the dental committee, so that's excellent. And delighted that there'd been, I think, as you say, meetings yesterday, meetings today with the BMA, which are the starters, laying ground rules for formal talks to begin. So all good stuff. You asked where I see it going forward. Yeah, the basis of the agreements that have happened in Wales and Scotland absolutely have to be it, because it can't be too unbalanced. Otherwise, we'll just have hemorrhaging of doctors across borders. I cannot see any benefit in ongoing industrial action at this stage, because they've got a new government. They've got a left-leaning government who's definitely trying to work with them. I can't see what industrial action would gain. What is also particularly interesting, though, Steve, is the situation with general practice. So an agreement has been reached with hospital consultants. An agreement has been reached with these SAS doctors, the associate specialist doctors, as we've previously discussed. General practice is in a very different situation. And for those who don't understand, general practice is comprised of doctors with sort of three main groups. You've got GP partners, who generally own and run a business, who've got a different sort of contractual relationship. And then you've got doctors who are employed on a contract, that's salaried GPs. And then you have quite a large bank of people who are locum, or if you like, occasional doctors. And they're all paid in different ways and contractually. So industrial action in general practice is very complicated, but work to rule is what's looking likely to happen. That's going to create all manner of difficulties for NHS England and systems, because if GPs work to rule, then they'll stop data sharing agreements. They'll stop report filling for people. They'll stop extended hours options. They'll stop doing a lot of things that people actually take for granted, but that are not part of our core business in general practice. That needs to be averted as well, and that needs to be bundled in these conversations first as last. What we need now is an opportunity to collaborate and work together professionally to fix the problems going forward. But that's just me. I am a natural collaborator, and I find it frustrating when people are so divided.
Yeah, well, we will see. Those discussions are ongoing. Let's see if my prediction is prophetic or daft. We'll never know. Right, let's take a break. We'll come back and we'll do some health stories in pod surgery. Welcome back. It's time for this. Right, Helen, pod surgery's open, and literally as we're recording, the government have just posted, further to our conversation about ministerial appointments on the government X, we've got two new health ministers. So Gillian Merron, Baroness Mellon, Merron, Merron, has been appointed the Lords Minister that we were just talking about there. And I think she's going to have the patient safety brief. Really, really important. Really good to see that. I don't know her. I know of her and I've met her at events, but I don't know her. The other appointment, which I think is really good actually, is Andrew Gwynn, who has got my old job as the Parliament Undersecretary for Public Health and Prevention, is what they're going to call it. So he'll have the primary care job. He'll be the pharmacy minister, sexual health minister, and all of the prevention stuff. He's a really, really nice guy, Andrew. People on the in the House on our side always think of Andrew as the angriest man in Westminster, because when he speaks in the House, he always looks terribly annoyed and terribly angry. But when you talk to him offline, he's really, really gentle and a really nice chap, and he'll work really, really hard. So I will be sending him a text to say congratulations when we finish recording. So there you go.
I'm delighted that he's somebody that you have respect for. That's excellent. I don't know Baroness Merron either, so she's not one of the people I was chatting to yesterday. Just looking her up, so it looks like she's been a shadow spokesperson for health and social care for a long time. Former MP for Lincoln, and had quite a few ministerial positions in government in the past. So she's
so she was the Lincoln MP back in the Blair days. So she's obviously now been ennobled.
Yeah, okay, fantastic. Well, that's
right.
Great stuff, and it's good to hear good people. Medical stuff, Steve.
Yes.
So
other stories in pod surgery. Where are we going to start? Measles and COVID, I believe.
Yeah, very quickly on infectious diseases. So we've talked about measles a lot. There's now a spike in Northern Ireland, whereas things have been calming down a bit on mainland. Northern Ireland have now got their spike. We all know that this is a real concern. It can be very dangerous. So vaccination. COVID, I don't know if you recall, but I had a little, and my husband had a little dose of COVID back
I
in
do.
May
The
after a long,
flirt variation.
yeah, that's it, flirty variant. It's still really live and kicking. In fact, I had two patients on Monday with it. In fact, both of them very kindly phoning for advice rather than coming into the surgery. But there were a lot of people coughing, and I suspect several others had it, although we don't test that much now. A reminder for people, if they have COVID and they test positive and they're in the vulnerable group, contact your GP surgery for referral for antivirals. That is available if you are highly vulnerable. So it's usually much older people, people with Down syndrome and specific disabilities. They will know who they are. Yeah, so infectious diseases, a lot of it around still.
Okay, thank you for that. I'm just going to raise a story that is out there on the news today about asbestos-related cancer, otherwise known as mesothelioma. A mum with rare cancer caused by exposure to asbestos is trying to raise awareness after it went undetected for more than a year. This lady, who's 41 years old, has been diagnosed with pleural mesothelioma, often most commonly found with older men, I think, isn't it? Who've worked in various manual professions. She's from Tamworth, so not a million miles from you.
Oh.
So she's got no idea how she came into contact with the substance, but she's been diagnosed with that. So is an awareness raising that she wants to bring out of her plight.
Yeah, so the prevention angle on mesothelioma is that it's almost always related to exposure to asbestos. And I suspect that in this poor lady's case, that at some point, probably when she was a kid, she will have been playing or somewhere where there was broken or damaged asbestos, and she inhaled some of the tiny fibers, which have sat and caused scarring on the lining of her lung, which have unfortunately turned into a cancer. But I've never heard of a case in anyone this young. Most cases are in older men who had been working in building trade. Actually, that's the commonest one. Indeed, my stepfather-in-law, he has pleural plaques. He's an electrician, worked a lot with asbestos back in the day before we knew how harmful it was. He's got pleural plaques. He actually lives in Spain now, but he's lived in the UK, Wales, all over the world. And he just gets monitored with sort of fairly regular chest x-rays just to check the plaques are stable. Mercifully they are. But I mean, a lot of people in the industry know about it. I think the awareness raising that's being suggested is that healthcare professionals bear it in mind. I mean, to be honest with you, people presenting with lung symptoms, getting chest x-rays done, I mean, that's how it's usually diagnosed. They're seen on chest, these plaques are seen on chest x-ray. But yeah, horrible. I mean, it only takes the tiniest amount. It's related to the size of the fibers of certain types of asbestos.
They get through. Yeah. Well, we wish her well. And
Yeah.
then final story from me, sugar tax story, which is a
Oh,
policy that we pursued when I was in the department.
great.
The amount of sugar consumed by children from soft drinks in the UK halved within a year of the sugar tax, a
Wow.
study has found. The tax came into force in April
Amazing.
2018, has been so successful in improving people's diets. Experts say an expansion to cover other high sugar food and drink products is now a quote, no brainer.
I
So that
agree.
research has been published in the Journal of Epidemiology and Community Health, and we will pop the link to it on our social media, as well as the Guardian story that covered this today, or yesterday, actually, the 9th of July, from Toby Thomas, who's their health correspondent, and really, really good. I liked the sugar tax. I was immediately attracted to it because it was about changing behavior through reformulation, and the companies responded positively to it. And what's more, we convinced the Treasury to put that money that was raised from the sugar tax into what's called the school sport premium, to fund school place sport. So I thought it was a win-win.
It's just awesome. So thanks for raising this one. This had passed me by. I'm so pleased to read this and hear it because it is a no-brainer. This stuff is a no-brainer. It's you manipulate and influence behaviors by doing it in quite gentle, subtle ways. Wow, well done. Big win, Steve, and let's hope that we can build on this going forward.
Do you want a quick Monty update?
Oh yes, we haven't had a Monty update for a few weeks.
He's got a thing. He's got a
Okay.
thing for Poppy Hunt. So
Okay.
Poppy Hunt is Jeremy Hunt's dog, who is a
Yes.
beautiful yellow lab, who
Oh,
he has met once. I, of course, have been out in recent weeks with Jeremy Hunt on the campaign trail.
all the photos.
He wanted to come because he wanted to see Poppy again. I fear that he has not entirely honourable motives, if I'm honest.
Naughty
But he
boy.
saw her in the paper because Jeremy and his family, including Poppy the dog, did a kind of departure walk down Downing Street last week, and Monty saw Poppy in the photo and is pestering me to hook up with her. I fear that he means hook up in the wider sense of the word as well. So yeah.
Okay. This isn't going out after the watershed, Steve, so let's just be careful what we say. But I mean, you know, a crush is fine. Let's not take it any further. You probably don't need to pander to him.
Yeah. Well, anyway, he still enjoys Daddy being home.
That's good.
And he will be watching the football with Daddy this evening, which is to come as we record. England in the semi-final, and who knows, maybe England in the final on the weekend. We will find out, won't we?
What our faithful listeners won't appreciate is that one of our brilliant team who helps us to generate the podcast is actually abandoned us this week. So thanks to Alex for staying with his post. And Toby, who is out in Germany, drove out last night having got hold of some tickets. So hope he's having an awesome time. Stay safe.
Yeah, good luck to him. Okay, right. That is us done. That's episode 34. You can find us podcast at stevebryan.com. You can find us on all the social media channels, X, Facebook, Insta, and LinkedIn with your ideas and suggestions or just your feedback. Please like us on whatever podcast platform you listen to your pods. And that's us for this time, Helen.
See you in a fortnight. Bye.
See you then. Bye.